All right, she's about to do the Met 43s to help flatten those nasolabial folds and get rid of any of the marionette folds as well. All right, she's marked up, and you can see the 4 marks in line with the lateral pupils and then in line with the ears. I make the face numb with a mixture containing 45 cc's of Haverson lidocaine with epinephrine and 5 cc's of sodium bicarbonate. I use the 1-inch 30-gauge needle for the entrance and exit sites, and use the 1.5-inch 25-gauge needle to connect the dots in between, including right into the middle face. Then put a little pressure on the area, give it 15 minutes to blanch. After it's completely blanched, I give it a little more. I prep the face with Hibiclens, put on the head drape. I make 2 1.5mm punch incisions in the temporal hairline, then pass this temporal needle. You don't have to go deep, you're just trying to get a little bit of superficial facet, not trying to enter the muscle. You then put these 2 Med 43 threads, just barely an inch into the area, pull the needle back and the thread comes with it. You pull it halfway through, and then you pass this blunt and sharp passler. Make sure whenever you're passing through the tissues, you're going deep, no dimpling, and only blunt is showing until you get to the very end where you pull back the blunt and then the sharp showing to pass it through the skin. You pull the sharp one out from below after you put the thread in. You repeat the process going from the top incision to the top 2 exit sites with the cannula followed by thread. And then you do the bottom incision to the bottom 2 exit sites. I will often cross the top one, but you're just not on this case. You're just making sure whenever you pass, you're going deep without force, pulling up on the cheek to help that, and always with the blunt cannula when you're passing through. The sharp is pulled back until the very end when you're trying to pass it through the skin. And then with the last one being passed here, you'll be grabbing all 4 threads, pulling them tight while you palm the soft tissue of the face up to the temporal hairline. This puts the soft tissue on the threads. You then cut them by pushing on the face. You then release any obvious dimpling. Then you're doing the same process on the other side, the 1.5mm punch, followed by the temporal needle, not going deep, putting in the threads just a teeny bit, then backing the needle out, pulling the threads through to the halfway point, and then starting from the top incision to the top exit. I go just past my point, just a little medial to it. I don't want to go through the mark. I feel like it might tattoo the skin, and I'm doing that for the 4 threads on this side. Always making sure there's no dimpling through the entire distance, and staying deep when I'm in the cheek, and always being in the subcutaneous space, but in the deep subcutaneous space. I make sure there's no hair stuck in this incision throughout, and always pulling back on the blunt passer when you're trying to get this sharp part of the needle to pass through. And then once again, pull any hairs out, which often get pulled in with the barbed threads. And then you grab the threads 2 at a time, or 4 at a time. You palm it all up, then you push back on the threads to make sure you cut them very short. You let go of any obvious dimpling. Now you're seeing her here at 2 days afterwards with a nice V shape.